Hello, welcome. Another episode of Something About Surgery. I promised to talk about complications of stomas. Now, once the stoma has been fashioned, several things can happen. The first thing that can happen is that the stoma can die off because of lack of blood flow. That is called necrosis. The stoma can pull down. Remember, an intestine was pulled out from inside the abdomen to the surface of the abdomen and held there, and an aperture created. It can fall back into the abdomen. This is called stoma retraction. Retraction is to pull back, and that can bring other complications with it. It can create infection around there. It can block off, and therefore the patient develops obstruction of the intestines and they are not able to open their bowel, etc. The opposite can also happen. The stomach can pop out. Larger part of the intestine can keep telescoping outwards, and this is called stoma prolapse. This is scary because a large part of the intestine is out, is not fitting in the bag that we have there, and the patient is in pain, and sometimes there is bleeding. What else can arise? Some space can appear around the opening or the aperture called stoma, and another loop of intestine can pop out, and this is called a hernia. Parastomal hernia, meaning a hernia next or parallel to the stoma. And then we have something that can happen days down, and this is stenosis. Stenosis is a little scarring with narrowing of that aperture. And as you can imagine, like we spoke with stoma retraction, then this narrowing means that the outlet for stool will be small, and therefore the patient develops stoma obstruction because of the stoma stenosis. Finally, there is one special complication that we see especially in patients with an ileostomy. Remember, in the last episode we said an ileostomy is when you bring out the small intestines and they create an opening on the skin. What happens is the small intestines can burn the skin around there. That is called excoriation. The skin can burn because the contents of the small intestine are still very high in the digestive juices from the pancreas, from the bile, from the stomach acid, all that. And secondly, the contents are not as solid as in the large intestine. So it is easy to spill around, and it keeps burning. And that can burn the skin around. And again, that can just remain as excoriation, or it can contribute to infection setting in, which is called a parastomal abscess. Those are technical, detailed things that perhaps do not belong to the lay person. But if you're a lay person, either taking care of a patient with a stoma, or if you are a patient with a stoma, these are the things to look out for, so that if something is abnormal and you are alone at home, then you are able to alert the doctor or go back to hospital for them to be addressed. Remember, as I said, I am gathering info and data for those who would be interested in joining a WhatsApp group for like a stoma support group. And you're welcome to key in your numbers there, and I will add you to the WhatsApp group to keep enlightening people and sharing more information that patients can use. Finally, if there is any information that you do not understand, either on the use of the stoma appliances in the first video or the various complications of stoma in this video, please do leave a comment with that question and let me get a chance to expound on them more. Thank you very much for watching, and I hope that you find this useful for the next patient who might require this information to take care of their stoma.